So I'm just waiting for the other YouTube channel. So one did go live, the other one did not yet. Just waiting for a couple more seconds, and if not, I will just start anyway.
10 seconds.
The one, my channel didn't go, and it's still trying, so.
Yeah, we're good on CHRIAS.
10 more seconds, Dr. Irgau, if it's.
No worries, Kemal, we're good.
Okay, I know why it didn't go through, so now it should be okay in 5, 4, yeah, it's coming up. So. Okay, so we should be on for both channels right now. Very good. So, good afternoon. My name is Kemal Erkan. Today is December 16th, Wednesday, 3 p.m. We are here again to discuss our bariatric process, bariatric surgery journey. Very good. So, good afternoon. Okay, so these things do happen. So, YouTube is a little bit slow. The way that we do this, it's our weekly event, and I have Dr. Isaias Irgau with me, and we are going to discuss another topic on the bariatric surgery support groups. Why do we need it? How often we need it, and what it is that we have at CHRIAS, and how we are supporting our patients. So we are going to actually go into the details of those. But before I go any further, I'm going to ask Dr. Irgau to introduce himself, and then we'll start from there.
Thank you, Kemal. Good afternoon, everybody. I am Dr. Irgau. I'm the president of CHRIAS, the Christiana Institute of Advanced Surgery. My specialty is bariatric surgery, which is weight loss surgery, and I have been performing weight loss surgery now for almost 20 years. Our practice, Christiana Institute of Advanced Surgery, or CHRIAS, is the most experienced practice when it comes to weight loss surgery in our area. We have set up centers of excellence in bariatric surgery in many of the health systems in our area. I'm very happy to be here with you today.
Thank you, Dr. Irgau. So from our side, again, the American Surgery Center is, since actually we started, this is 2015 at the Surgery Center, but prior to that, actually, we are the bariatric surgery name, the signature and the brand of bariatric, especially in the state of Delaware, it is CHRIAS. All of our surgeons are the big part of the bariatric program since the beginning of CHRIAS. And Dr. Irgau, that started in like year 2000, I believe, right?
That is correct. That is correct. Yeah, 2001 was our very first bariatric procedure.
And now most of you who are traveling on 95 can see our billboard, and I'm going to use actually our billboard to introduce our other surgeons. Other than Dr. Irgau, we have Dr. Gail Wynn, Dr. Mike Peters, Dr. Rose Singh, Dr. George Ibrahim on the bariatric side, and then we have Dr. Sachin Bait, who's going to be with me tomorrow for the colorectal and colonoscopy during the COVID-19 pandemic. He's our colorectal surgeon. And at the surgery center side, we have Dr. Neil Kalan as an ophthalmologist, actually. Since he's on the billboard, I just want to mention his name as well. As you most know by now, that we have different parts of, different types of bariatric surgeries we are doing, but mainly we do the gastric sleeve. We have gone through those details in different videos that you can actually find the specifics. Our dietitians who are specialized in the bariatric, Fran, Amy, and Beth, so they're part of our team. And just very shortly with the process of bariatric patients, bariatric surgery, it's a long process, and then we believe that after you go through all these different steps, being able to have a good support is important. So that's why it's important for us to discuss our support group approach. Now, Dr. Irgau, the support group is nothing new for us. We have been doing that for a long time, but we are in the process of restructuring that. So if you can actually just bring us back up to date with what we have been doing so far, and then we can actually take it from there.
Absolutely. Kemal, as your last slide showed, we talk about a bariatric surgery process or journey, right? It's not a one-time event. It is a lifelong event, bariatric surgery, right? Because first of all, we are dealing with a disease that has devastated people for most of their lives, right? We introduce very powerful tools to help them get rid of this disease, which is morbid obesity, right? But after that, it's not over, right? The patients go on to live a healthy life, but they will need to be followed up by our practice on a regular basis for us to check their nutritional level, but also their continuous engagement with a healthy lifestyle. And having a support group within this process, actually, it's a very natural thing to do. Because what is a support group? A support group is what the word says. It's a support group, meaning that we bring together people who have experienced the same disease and who have chosen to get the same solution and treatment, which is bariatric surgery. And then they talk, they network, they discuss, they bring about issues or challenges they may or may not have expected, and they look for solutions among their own peers. So when we at CHRIAS, we participate in these support groups, we are merely moderating and facilitating this, right? The main discussion really is between the people who've had bariatric surgery, so that issues that any particular individual wants to bring about will be discussed from different perspectives of people who've had similar surgeries as well. So we've, from the beginning, recognized that bariatric surgery has to be performed within a context of a program that includes different specialists and experts. But that program has to be there with the patient, not only in the preparation of the surgery and in the execution of the surgery, but also in life after surgery. And that can be in the form of visits frequently with us, but also in terms of support groups. So support groups is something that we've had all through the program. Now, until very recently, our support groups were being done in person, right? Where people used to come physically, and we used to gather once a month and talk among ourselves and with the patients about issues that were relevant, right? But with the pandemic, the physical interaction has been obviously de-emphasized for safety reasons. But at the same time, because of the pandemic, we have discovered very powerful tools, online engagement tools, just like the one that we're using today, that can bring us together actually with added convenience as well, so that people don't have to travel, don't have to drive. Now, so we are doing these virtual support groups, which are similar to the ones we did in physically, but obviously the platform is different because we're not interacting physically, we're doing it in a virtual setting. Now, whilst we're restructuring this to do it in a virtual fashion, it doesn't mean that we will never have physical interaction either. Once the pandemic is over, I am sure we could come up to a hybrid arrangement where some of our support groups would continue to be virtually done and others may be done with physical interaction, which by itself also has some meaning and some utility to itself. But at the moment, whilst the pandemic is going on, we will continue our support groups, but in a virtual form.
So, Dr. Irgau, just so that we can kind of maybe relate to this, so when we say support groups, so many people can think so many different things. So the reason here for the support in some cases is for us to be able to share the success stories, but also there are patients who are not maybe able to get these similar results. So then for those patients to be able to address their problems, or their questions, or those people who are doing better, if they can actually share what they are doing differently. I think those are all different things that's important. It's not like the support group where our patients necessarily need support, but it's more about there is a need from the social standpoint with the obesity, especially having the social pressures, right? So we have like the social blaming in some cases, right? We have gone through these a lot because our patients, they deal with these issues lifetime. So when they decide for something so important, they want to be able to share those stories. And then this is really good for us to be able to actually put these all together. But again, this is nothing new. We have been doing this, but now we are restructuring it in a way that it's going to be done first Tuesday of every month. The first one is going to be on January 5th. And then I think the expectation from our side is we don't want to take the entire time for our presentation. We'll discuss a topic, but then the rest of the time we want to have dynamic dialogue between our patients. So then it would be a good platform from that point. Now, Dr. Irgau, if you can talk to us about the effectiveness of these support groups and just so that we can actually guide the patients in the right way.
Absolutely. I mean, there have been actually scientific papers written, Kemal, to demonstrate that people who've had bariatric surgery and participate in support groups overall experience a better outcome in the long term, right? And the MBSAQIP, which is the organization that certifies programs for Center of Excellence, recognizes that having a support group is an important component of a program. So remember when we had our surgery center, for instance, coming up for evaluation to be designated a Center of Excellence for Bariatric Surgery by the MBSAQIP, one of the items that they looked at beyond the expertise, beyond the multidisciplinary evaluation is whether we offered a support group, and that is an important component. So they recognize that the support group is important, right? So obviously our patients have the surgery, but they are going to go on and live in the real world where there may not be other people who've had surgery amongst them, whether it's a place where they work, whether in their families, right? So if they have challenges, if they have issues, finding a place where these issues not only are understood, but are sympathized with is very important for them, right? The challenge could be tolerance of a particular type of food. The tolerance could be stress eating. The issue could be a self-image, with skin excess or other things. Or the issue could be time to find exercise and how do you do that, right? If there are other people who had surgery and these issues are bound to have come up to them as well. So sharing the problems, but also sharing the solutions really makes a lot of sense, because the more people you have participating, the more likely it is that someone will have had a similar issue, and then they could come up with a solution that they have tried and perhaps found it was good. So having support groups really is very beneficial for our patients going forward.
Dr. From the patient standpoint, I guess having the support group, especially after the surgery, is more important, because prior to surgery, we have so many different appointments with different specialists, but also our nutritionists. They do really a good job to keep the patients up to date with the process, give them this, even in some cases, what social workers would do, they are actually providing a lot of support from that point. But I think after patients are able to go through the surgery and then start losing weight, they may have some access issue. So now, do you agree that this is more important after the post-surgery?
Yes, absolutely. I think it's very critical after the surgery, because obviously we want to make sure that people have a crutch they can lean on when there are different types of struggles that come up. These struggles could be, practical daily things, they could be long-term issues, or they could be acute problems related to stressful events in their life, and finding a place where they can verbalize this and finding a sympathetic echo to that is very important. So after the surgeries were obviously very meaningful, one could potentially, think about a combination support group also, and there are some in the country where there is a mixture of preoperative patients and postoperative patients. And obviously the emphasis at that time may be really networking these patients so that the patients preparing for surgery could talk and find somebody who had the surgery, and they could ask them specific questions, that they can come up as they are preparing for the surgery. The format we have chosen right now, as you correctly said, is specifically for postoperative patients, because we do have a fairly intense encounter with different specialists and different experts before the surgery that will give most likely the answers that our patients will require. Having said that, I do find myself sometimes with patients preparing for surgery asking me to refer them to somebody who's already had surgery so that they can connect with them. And we do that as well. In fact, many of our post-operative patients who had the surgery, volunteered to become almost a mentor to some patients, and somebody that a patient preparing for surgery can hook up with. So this kind of interaction has happened, although it's more of on an individual level, essentially. And then the other important thing to remember about the post-surgery support group is that, patients can bring about their own family, other people who are interacting with them very on a daily basis, for them to also be exposed to other patients who had surgery, so they can support their loved ones even better, for their needs after surgery.
So, Dr. Irgau, you mentioned the role of the facilitator in this. Can we just elaborate that a little bit? So in this case, facilitators would be us, right?
Yes, absolutely. Yes.
So if we can just elaborate that a little bit, so then we can have a better understanding.
Absolutely. So it should not, the support group leader or facilitator should not be thought of as somebody who is going to be presenting something, or who just going to be answering questions directly, although that can happen as well. Remember, this is a much more dynamic interaction between all the members. So it is important that the facilitator really is knowledgeable about this dynamic. So not only everybody is allowed to have a voice there, but also that everybody feels comfortable to come up and talk about issues. You don't want the whole meeting, for instance, to be dominated by a particular issue or a particular person that others may feel may feel turned off, and then not having enough opportunity to participate. So the facilitator obviously has a very important role to making sure that all the voices are heard, all the issues are discussed, and then everybody has a chance to talk freely without any constraints or without any discomfort about issues that may matter to them specifically. Now, there may not be time to go through everybody's issues in one session. That's why there has to be a repetition of the sessions. And right now we do them on a monthly basis. There are other programs who do them on a quarterly basis. We've chosen monthly because we have so many patients in our program that kind of frequency is important for everybody to be able to participate at some point. So we may not be able to get everybody's issues discussed in one session, but we will have ample opportunity with frequent sessions, the way we have, scheduled them.
And I guess the other thing for the benefit of the support group is for patients to getting back on track, right? So we discussed that a little bit, but I think that's really important in some cases. I'll give you an example from my own diet, right? So before pandemic, it was different. So after pandemic, everyone went through this, like, oh, we are home now, so we should be eating. Like, so we start making desserts and we start making stupid stuff that we normally wouldn't eat just because we were home. That's true, right? So we all went through
Absolutely.
And then all of a sudden reality hit. We are back in the office. It took almost 7 months for me to go back to my normal diet. Well, well, I'm not a bariatric patient, but we discussed this is not just for the bariatric patients, this is for all of us. We are going through this. So in the last 3 weeks, I'm back on my regular diet. But if I didn't have the regular conversations with you, then I wouldn't be able to get back to that very easily. So just so that our patients also would appreciate this probably. So just from the support standpoint, in the first couple of days, we were texting each other to make sure that we are on track with what we are doing. But many patients, they're not able to go back to regular normal behaviors that they have prior to these issues. So how would this help us from that point, Dr. Irgau?
So that's actually a great example of going back on track, as your slide actually puts it, Kemal. Because remember, there are struggles that we may go through individually, right? Because I'm doing very well, I've lost 100 pounds, and I'm 2 years out, and then suddenly I lose my job, right? And then I have a lot of stress, and I have a lot of emotional reactions to that. And then snacking or eating becomes a way for me to deal with it in the short term, right? Then suddenly I'm off track, right? In terms of my weight loss journey, because as we repeatedly say, bariatric surgery is not a magic answer. It's a powerful tool. So if you're off, then you're likely to struggle again with the weight. Well, having this type of individual struggles is is something that can be resolved if you were able to go back to a place where others also are discussing similar issues. Now, the pandemic has brought up a more universal and more communal problem for all of us. As you correctly said, we are relegated for a period of time during the lockdown. We were all at home. We were all hoarding food because there were perceptions about shortages of food. So we all went to shop with a lot of food in our house. We all started cooking as a way of passing time. And then eating also was a way of getting, over the stress of the whole situation. So all of us, and certainly all of my patients, were struggling throughout that period because of this issue that we had with the pandemic, right? So being able to talk about this in a support group setting where we all suddenly realize we are under this spell that is forcing us to really be off track is an understanding or a realization that we have to go back on track. And how do we do it? Well, we can discuss, right? We can discuss, do we go back to creating some form of intermittent fasting so that we have scheduled times in which we eat and then we drink water on other times? Or should we just make sure that what we are hoarding in our house and shopping is healthy stuff? All these are solutions that can come up once you become aware of the situation you're in. And the more people discuss together about this, the more likely that this will be looked at with a particular focus, so that when you come back to the next support group, you could say that this is the solution I've implemented, and these are the results I've seen, essentially.
So for our potential topics that we will be discussing, as we mentioned before, but these would be, we would take maybe 15 minutes if we are going to do for 45 minutes, so that like the stress, emotional eating management, skill building for long-term weight loss, social support pressures, goal settings, nutrition, and exercise. So I think when you find people who have the common interest or common problems in some cases, it's the way of getting out of these issues is really important for us to be able to cope in a different way or successful way or efficient way. So if you are struggling with this and then you have friends who are not actually going through the same issues, you may not need to torture yourself. The way that you are going to actually get out of those is finding people who have similar issues, so then we can work on the similar goals. So it's making it extremely difficult. The interesting part on this one is same with the patients with diabetes. If the people, you can just find people with diabetes to be friends with just so that they can support you. However, if the people are not educated in the household or your friends who are understanding your situation, it becomes more difficult. So we actually discussed that while we were getting ready for Christmas, and prior to this, it was Thanksgiving, how we are going to cope. So you have to make sure that everyone is on board with what you are doing.
Absolutely.
And otherwise it's going to be difficult.
Absolutely. Absolutely. Yeah. So, we do the surgery and then it shouldn't be, I've had the surgery now, I'm on my own. We're a program. We're a program that is committed to support patients from the beginning through the surgery and importantly afterwards as well. And part of that commitment is to provide this platform whereby we can bring patients that some may be a year out, some may be 10 years out, but who will have more experience so that they can share this. But also the other usefulness that many patients tell me about support groups, Kemal, is that it creates a sense of accountability, right? Because you want to do the right things so that when you get up and talk, you can share that experience as well, right? And also it gives you a sense of strength internally as well, knowing that you've had a chance to focus on this with other people, you find a solution, and it gives you a strength really to implement that solution. When you go back for the next support groups, you will have something positive to contribute as well. So I do think that a program like ours that has support group meetings actually adds a lot more value to the whole, treatment of bariatric surgery, so that the success of the patients is really a long-term success.
Sure. And Dr. Irgau, while we are kind of getting ready to the end, so the first Tuesday of every month on the digital media, we are going to have these events. So what's really important is for our patients to be engaged and participate. So then actually we have a good number of people who are participating, and then everyone can benefit from these. January 5th is the first one coming up. Now, while we are here, I do want to make sure that we share this again. I try to do this for every meeting. We are reaching out to so many people through social media. We have on also our YouTube channel, so it's almost like a TV channel now. We have so many different videos, so many different playlists to make this easy for our patients to, or anyone actually. It doesn't even have to be a patient, because I personally learn a lot from these sessions. Even if things that I feel like I already knew about, I still learn more. So that's a really good way to actually keep up with what's happening. And in terms of our, now one reminder, please, if you don't have your patient portal active, activate your patient portal. It is becoming more difficult for patients to reach out to us on the phone, while we are much more efficient when we are able to use our patient portal. We will be coming back to you quickly. In some cases, you don't even need to reach out to us, right? So in some cases, you need to cancel your appointment, or you need to see when your next appointment. You can go to the portal. Instead of spending like 10 minutes on hold on the phone, it's better to use portal and get through that. It will be more efficient for all of us. Lastly, we have 2 more events this week. Our colorectal surgery and colonoscopy screening during COVID-19 pandemic is by Dr. Sachin Vaid tomorrow at 12:30. This is the second time we are doing this with Dr. Vaid. And then my weekly update from United Medical ACO related to COVID-19 and other new topics is on Friday at 12. So that's what we have from our side in terms of the new events. Now, again, I do believe that we are providing a lot of good information here, and I'm hoping that everyone is also enjoying this. So next week is going to be a short week for us. So, but I believe we'll still have our Wednesday event on, because Thursday we are off before Christmas, but Wednesday we should be having this event. So, Dr. Irgau, any closing comments?
No, that's it. I do want to emphasize that the support group is open for all our patients. There will be a way for them to register through our website. And as Kemal mentioned, the first one is going to be on January 5th, and hopefully many people can take advantage of it.
All right. Well, Dr. Irgau, thank you so much again, and we'll see you next week. Thank you again. Bye-bye.
Stay safe, everybody. Bye-bye.